As the advent of healthcare progresses on with newer technologies coming into the picture every single day, are the hospitals of today becoming dinosaurs? That is a question that we will answer today. The hospitals of today may not be considered as dinosaurs in the traditional sense, but they are facing challenges and changes due to advances in technology and medicine. Healthcare delivery is becoming more integrated and focused on preventive care, which may require hospitals to adapt from their traditional roles. However, hospitals play a crucial role in providing essential medical services, emergency care, complex treatments, and are likely to continue to do so in the future. So, then, what is the future of health, and is it home based? So, the future of health is likely to include a growing emphasis on home health as technology and medicine make it possible to deliver more care in the home settings. This trend is driven by desire to improve access to care, increase the patient comfort and convenience, reduce the cost of healthcare delivery. However, it is important to note that home health is not a replacement as of now for traditional hospitals. And right now, a mix of in person and remote care will likely be needed to meet the diverse needs of patients. Additionally, there will be a need for continued investment in traditional hospital infrastructure to ensure that patients have access to the highest quality of care when it is needed. So, are we going to see things like tele ICU in the future? Tele ICU or intensive care unit using a telecommunication is a system that allows remote monitoring and consultation of critically ill patients in the ICU. It involves real time video and data transmission between the patient's bedside and a remote team of intensivists, nurses, and other healthcare providers. Now, the goal of tele-ICU is to improve the patient outcomes by providing continuous monitoring, timely intervention, and access to expertise. The technology is especially beneficial when we are dealing with rural patients or understaffed ICU, or if the patient is based at home. While tele-ICU is a relatively new development, it has the potential to revolutionize the delivery of intensive care unit care and provide better access to critically ill patients who are at home or in a rural setting. The next question is, are we going to see a rise in home-based surgery? So home-based surgery refers to medical procedures that are performed in a patient's home rather than in the hospital. This type of surgery is made possible by advances in minimally invasive procedures and technology that allow for safe and effective surgery to be performed in a home setting. Home-based surgery is often less expensive, more convenient for the patient, as it eliminates the need for hospitalization and reduces the time and cost associated with traveling to and from a hospital. However, it is important to note that not all surgeries can be performed in a home setting as of now, and the safety and quality of care must be carefully considered and monitored. The decision to perform surgery in the home setting should be made by a qualified healthcare provider and should take into account individual needs and circumstances of each patient. Another question that we have is, are we going to have home-based radiology services? Which basically means that we're going to have diagnostic imaging that can be performed in a patient's home rather than in the hospitals or the radiology center. This trend is driven by advances in technology and telemedicine, which make it possible for patients to receive certain type of image testing in the comfort of their home. Home-based radiology can increase access to care, reduce the cost and in the inconvenience to travel, and make it easier for patients to receive the imaging tests that they need. However, it is important to note that not all imaging tests can be performed in the home setting, and that safety and quality must be carefully considered and monitored. That general practice artificial intelligent algorithms can analyze patient data such as their medical history, their lab results, their demographic information, and provide personalized recommendation and support. Is that gonna be more and more? Yes. And it has the potential to revolutionize the practice of medicine. And also, it has the potential to make medicine virtually, the consultation part of it, virtually free. At the same time, there are some ethical issues or ethical principles that need to be adhered to, such as data security, patient privacy, accuracy of the patient data, and the accuracy of the diagnosis and the treatment that is given. Apart from that, there is another thing that is on the horizon, which is home-based healthcare robots. Now, these healthcare robots sort of work like assistive technology, where they do the monitoring of vital signs, deliver medication to the patient, and also provide assistance in rehabilitation for daily activities. They improve the access to care, they increase the patient independence, they reduce the cost and the burden of care for the patient and their family. We are entering into an age where they are going to be more and more. Also, we will simultaneously see something such as a home health and IoT. IoT is Internet of Things. So, for example, you will see wearable devices, wearable health monitors. You will see smart home systems for monitoring vital signs, and also you will see connected medical devices. So, your home, basically, your whole home can eventually become something like a wearable device, in which your bed could calculate your weight, your blood pressure, it could calculate your pulse, your oxygen saturation. Numerous things can be done at home. For example, if the patient gets sick, then or has an emergency, then an alarm is set off directly to the health services in that region, in that geography, so that the patient gets care even without asking for it. We are entering into an age of abundance that will be driven by technology. And home health, people getting health in the comfort of their home, is going to play a larger role than it has ever done previously. We don't know what the future is going to be, but we can be sure that the future is going to be great for health and for patients as a whole. Thank you. Please don't forget to like and subscribe, and don't forget to click on the bell icon. Thank you.